many innovative interventions and services to improve the mental health of children and young people around the world. But how can we make interventions and services more child and youth focused and more engaging? We asked several young people and professionals from different countries, and this is what they suggested.
E é uma coisa que eu acho que a gente tem que começar a desconstruir, porque a saúde emocional tá aí. A gente sabe que sofremos por causa dos sentimentos, e muitas vezes eles nos motivam também a fazer as coisas. Só que a gente tem que entender que sentimentos, sim, incapacitam as pessoas e as doenças com a saúde emocional estão aí. Depressão, ansiedade, e isso sim, incapacita uma pessoa e não é drama. A gente tem que começar a entender isso, porque eu vou dizer sempre, sempre do quão maravilhoso seria um mundo em que eu fosse atendida por pessoas da área educacional, de várias outras áreas também, por pessoas que entendam o que eu tô sentindo, não vão achar drama e que entendam que sim, às vezes eu vou estar fazendo alguma coisa de uma forma pior por causa do que eu tô sentindo. Eu acho muito importante que a gente comece a validar essas coisas, porque parece que a gente só entende o quão ruim é quando é com a gente. E não tem que ser desse jeito, sabe? A gente pode educar as pessoas para pensar a importância de saber respeitar o seu tempo de fazer as coisas, de entender que é normal estar mal. Até rimou, né? Mas, enfim, a verdade é que sim, a gente tá mal várias vezes, isso incapacita a gente. Então, é engraçado, porque parece uma coisa tão óbvia quando é com a gente pergunta por que não me entendem? Mas se pergunte agora também, será que você dá importância quando as pessoas se dizem mal por algum motivo e dizem que não conseguem fazer? Ou será que você só diminui o que ela tá sentindo? Então, é uma coisa que a gente tem que desconstruir, porque é importante, temos que normalizar os sentimentos e as doenças que surgem dele.
Mindfulness intervention module can help adolescents learn a very important skill for negotiating not just adolescence and adulthood. And we are all aware many adults do not have emotional regulation, do not have self-management, stress management. Those skills need to be taught at much later date, and a lot of adults struggle with it. And if we can teach our adolescents mindfulness as a way of negotiating issues of life, then they would have more control over stressful situations and emotional competence, and maybe they'll have less psychological issues.
Youth being involved in solidarity, donations, empathy, being more responsible with their territory and how they can be part of the solution. So that's something that we've been getting them on board, like with their peer-to-peer support, but also with a safe participation, with also having them have the safety or the security of being supportive of their peers that need help. Is understanding about the recognition of their expression, self-knowledge and self-esteem, and how to deal with their anxiety, and not only how to build resilience, because most of them already are resilient because they live in with such vulnerabilities all put together. It's just that how do we help them understand that those tools and what is necessary for them to.
So we decided to have the action with the youth based on our concept of taking care of me, bringing youth to reflect, to have lived experience, and how to promote their self-care. So we focus this initiative to give them these tools to start taking care of them in order to instrumentalize them within lived experience and circle talks, within mental health promotion, and it strengthens them to use those circle talks to be a peer-to-peer support. So the initiative is called in Portuguese Caixa de Ferramentas, is a toolbox of mental health, a box of mental health tools, and we developed in 3 axes. It's to empower them to have the lived experience, and then they go within their peers to start giving support. But it's all within a network and professionals that are in this network for them.
We address stigma directly. And the first thing we do in a session talking about stigma is to share stigma experiences. You know, at any one time, I'm sure each one of us may have experienced a situation where you felt you were discriminated or you were stigmatized. So we share those experiences, and people know that, you know, they're not the only ones, you know, being discriminated against. And then from then we teach the coping skills. How do you cope with something like that? Yeah. So there's a whole set of skills that people can learn to be able to cope with stigma. And after that session, participants are more, they're stronger, they're encouraged, they're more confident that, hey, even though I have this, I can overcome it. Besides, they've had the experiences of the group members as well. Even the facilitators, we teach them to also share their stigma experiences, you know, while growing up or in any other situation, so that people know stigma, yes, does happen, not only in the HIV context, but also in other contexts. You know, stigma and discrimination does happen. So that helps people, you know, come around, become stronger, and, you know, with the skills we teach them, they're able to live with it.
We are also implementing lots of activities within the scope of social cohesion. And our main purpose is to make sure that the local people and refugee people can practically live together. Within that scope, we are implementing activities like breakfast activities. We are doing home visits in order to make sure that the local people and refugee people can practically live together. So you can see, like, we are also targeting parents in order to make sure that the cohesion will be achieved by parents level and the children.
If you see a kid struggling with his academics, with his personal life, and I don't even mean a kid aged from 5 to 12 years old. No, I mean a kid from 5 or even younger to 20. Trust me, even 20, 23-year-old people do not have their life figured out. And it's just a mess for them too. But yeah, if you see a person just struggling, a youth struggling, then be there for them, support them however you can, through emails, voice messages, texts, calls, whatever your profession allows, however you can. Trust me, it means the world to them. I still remember my teacher who supported me through my hard times, even when I was in class 5. I was just 10 or 11, that's it. I still remember her, and we still talk. Not about the past, but just a hi, hello, how are you, how is life? I remember her, and she remembers me. So I know for a fact that when you see a person who's struggling, it just does not go out of your brain. But it means the world if it stays in your brain and you reach out to them, even if they're not great on the receiving it, even if they want to push you away and just make you go away from their lives, but just be there. Trust me, it matters the world, even if you cannot do anything or bring the change. Just the fact that you're there and there's a support system they can turn to means the world to them.
Can have responsibility to look after a certain thing, they will give more focus and they will give more energy into the thing than if someone else is in charge or is in control of what I have to benefit. So that is what I think some interventions and some other services and some other programs do wrong, because then they go there and say that we are responsible for this, but let me be responsible and let me follow you on what you want me to do. Then it would actually give me a platform to actually showcase and give out what I am capable of as a youth or as a child. Building the relationship between youth and the service giver, or between the child and the service provider, that's more important, because then I do not see you as a person who's just giving service. I now see you as someone I trust and someone who is actually family or who's actually blood. Then that opens up my comfortability, you know.
But the key thing I want to point out to you that we learned in terms of these young people and these devices, as we were doing some of this research, was that much as they might use these devices to kind of, you know, try to connect with friends and try to connect with other people, there were two components that stood out in Los Angeles' study. Los Angeles found that if they were connected to reliable adults, right? And I think everybody who's on this webinar today probably qualifies. Professionals, you know, as mental health professionals, we qualify as those reliable adults. They were much more likely to engage in pro-social behaviors, less likely to engage in criminal activity, less likely to engage in sex work or prostitution if they had these positive influences in their networks. You know, they really, you know, helped us understand how it was that these devices are really a lifeline for many of them. When you don't have a physical address, a virtual address can be even more important if you can get access.
It as if you ever want to work with children who are vulnerable and underprivileged and want to reach out to them, remember to always start simple and always start small. It's connecting with them, reaching out with them, with sometimes very basic activities. Instead of planning very hardcore interventions, it's better to understand their needs and then reach out accordingly. And take time to build trust. Like I said, when we go to the community centers, when we go to the care homes, it takes a lot of time for them to understand that we really genuinely would like to improve things for them. And we're just not inquisitive or not just kind of coming in to figure it all for them. We just really need to build trust and see it as a two-way relationship. All of us can make a difference. All of us can make a difference. We all can contribute. We all can work together. And it's sometimes the little efforts from each individual member of the society that can really make a difference in the life of a child. Respect and reach out. And I think that's what I've learned over the years working with the community and working with care homes and working with vulnerable children in general, that if I do want to reach out to them, I need to respect where they are coming from. And I need to understand their position and then be able to reach out to them and guide them. And
in my years of being in care, I've observed and I've seen that many children are being treated as the problem, you know, not actually as the victim of their circumstances or their situation, because then when they come in care, they feel punished, you know, they feel neglected. But if more would be explained, and if more would be, you know, taught to people coming in care, or children or youth coming in care, I think then it will make, you know, the process of a child or of a young child being in care better, because then some other children tend to run away, tend to, you know, just have a negative attitude towards care. But I think I really appreciate care of what they have done, you know, feeding children, being so patient with other children, whereby others would even come with anger issues, some others would even come with bullying issues. But then I think care has been patient and has been waiting, you know, for them to respond to their call. And that is something that I've picked up. But then I think if care can be more welcoming and, you know, just showing the child that you are not here because of punishment, or you are not here because of you have to do this, or you have to be actually in line, or you have to be strictly actually, if them knowing that their future is in their hands. And I think that would also be great, because care is more of overprotective, you know, over youth and over children. But if they would let them have relationship in the community that they are going to after care, in the communities that they are going to help after care, I think that's going to be more, you know, more effective, you know, in the lives of young children.
You can see that we are working in many different areas. So we are working in protection, education, legal consultancy, shelter, social cohesion, rehabilitation, MHPSS, social cohesion, and youth center.
3 key pillars of Kids Haven are, you know, pre-care, which includes prevention, early intervention, community development. And these are actually children that have never been in the center and are actually at home and their families, to ensure that we have, you know, good family strengthening and support programs to keep children in their own community. And the second pillar, we have residential care program, which is actually in care where that is where all the children are, where we provide all kinds of, you know, therapeutic intervention, education, and, you know, and other kind of programs. And the last pillar is actually after care, where we support kids that have left care and to ensure that, you know, they successfully reintegrate back in the community and they actually function, you know, normally back in the society.